One of the most important parts of getting through our episode of low back pain is getting back into exercise and getting back into movement. When the back pain starts, the muscles around the spine are going to restrict the joints and restrict the area to kind of protect it. What that ends up doing is it creates a stiff block back, and when we want to work through is we'll use adjusting and spondylolistherapy therapy and manual therapies to get those segmental motions back. And what that does, it helps send those messages back up to the brain, so the back and the brain know how to use each other, and the brain knows how to use the low back when it comes to bending, stooping, walking, and all those things. Because when we first does this, this gets really locked up. So as we do our things and we get to that next phase of care, so first we get rid of pain, we get the pain down, then we want to start working on rehabbing that back and getting that communication between the two areas back. So we just want to work through that. One of my favorite exercises is working the cat-cow. This one is we're just flexing the spine and coming back, just getting into a range of motion and working through this to get through even just upper back, and then getting into the pelvic movements so that we can get into how the brain is communicating with those areas. And then my favorite is taking it to more of a dynamic movement. So going up, arching the back, coming back down, and then getting the spine long. So we're learning how to go from a flex position to an elongated position and then coming through. So we're just creating this whole spine movement, going around our axial joints, going around the shoulders and the hips, so we can understand how to integrate this back in. The more feedback we can get to the brain so we can understand where we are in space, getting that back helps us to create better movements in the long run.